A kidney is an organ that functions to filter waste out of the blood and ultimately excrete it out of the body through the urinary system. Kidneys affected by polycystic kidney disease are characterized by the presence of many fluid-filled cysts. These cysts usually cause great enlargement of one or both kidneys and severely impede kidney function. Of the two types of PKD, those affected with autosomal recessive PKD usually die before birth, whereas those with autosomal dominant PKD generally live several decades before suffering from its side effects.
So why does learning about polycystic kidney disease matter? PKD is the most commonly inherited kidney disease and the fourth leading cause of kidney failure. Approximately 600,000 people, or about 1 in 500 to 1,000 people, are affected in the United States with no discretion for race or gender. Preliminary symptoms of autosomal dominant PKD usually begin to surface in affected individuals as young as 30 years old, with kidney failure occurring not long thereafter. By age 70, 75% of people affected require dialysis.
Why should we care about polycystic kidney disease? PKD severely impedes the quality of life of affected individuals. It is a genetic disease passed from parents to children, meaning learning more about the symptoms and mechanisms of the disease, finding out if you are a carrier, and speaking with a genetic counselor about the risks of passing the disease to your children can prevent future generations from suffering its consequences. In addition, research on how to reduce symptoms and side effects can improve the lives of those already affected. It is critical that we understand the disease and find ways to prevent its harmful effects upon first indication of symptoms, before it manifests itself in the kidneys.
The most common symptoms of polycystic kidney disease are pain in the back and sides, between the ribs and hips, and head legs. The pain can either be temporary or persistent. Other symptoms include increased abdomen size and tenderness, drowsiness, urinary tract infections, and more frequent urination, especially at night.
Additional complications associated with long-term PKD include blood in the urine, joint pain, nail abnormalities, kidney stones, kidney failure, liver and pancreatic cysts, abnormal heart valves, high blood pressure, aneurysms, painful menstruation, and diverticulosis, which are small bulges in the colon.
How is polycystic kidney disease detected? Unfortunately, many people who have autosomal dominant PKD do not develop signs or symptoms for years. If you have some of the symptoms of PKD, or if you have a first-degree relative with the disease, see your doctor to discuss if you should be screened for this disorder. Polycystic kidney disease can be detected by an abdominal ultrasound, CT scan, or MRI scan, as well as by an IVP, which is a special X-ray for the kidneys, bladder, and uterus. If several members in the family have PKD, genetic tests can be done to determine if someone is a carrier of the PKD gene. Fortunately, if you have no family history of PKD, you are not at risk of developing the disease.
Autosomal dominant polycystic kidney disease, also known as ADPKD, is the most common form of PKD, occurring in about 90% of affected individuals. This type of PKD is caused by a mutation in either the PKD1 gene, which encodes the protein polycystin-1, or by a mutation in the PKD2 gene, which encodes the protein polycystin-2. The second type of PKD is autosomal recessive polycystic kidney disease, also known as ARPKD. This form occurs in 10% of all PKD cases and is caused by a mutation in the PKHD1 gene, which codes for a protein called fibrocystin. Those affected with this type of PKD typically die before they have been born. This type of PKD causes renal cysts of tubular epithelial cells in the kidneys.
Disruption of those proteins encoded by the mutated genes causes dedifferentiation, excessive fluid secretion, and proliferation in the tubular epithelia, leading to cyst development. ADPKD and ARPKD both affect cilia, calcium homeostasis, cyclic AMP, concentrating capacity, and various signaling pathways. For instance, cilia in the kidneys functions as mechanosensors, which measure the fluid flow through the kidneys. Calcium influx into the kidneys is directly dependent on this flow. PC1 and PC2 mediate these calcium influxes, so a mutation in PKD1 or PKD2 alters calcium homeostasis and thus increases levels of cyclic AMP. Unfortunately, even though decades of research has been already done at the Mayo Clinic and Johns Hopkins University and many other research institutes, many of the specific mechanisms behind polycystic kidney disease is still poorly understood. Polycystin-1 and polycystin-2 causing autosomal dominant PKD have a very large range of applications in the body, and it is proven difficult to determine specifically which function mutation causes PKD. Although fibrocystin is known to underlie the disease pathology of autosomal recessive PKD, the exact mechanism is also unknown.
Unfortunately, there is currently no cure that would prevent PKD cyst from expanding and enlarging. Because it is a genetic disease, the only known way of preventing it is by not having children, and therefore eliminating the risk of passing it on to offspring. However, there are ways to slow and delay the onset of the disease by maintaining a healthy lifestyle. Blood pressure should be controlled so it is below 130/80. In addition, cardiovascular risk factors should be controlled by eating healthy, not smoking, and exercising regularly. Furthermore, pay attention to medication taken. Avoid non-steroidal anti-inflammatory drugs such as Advil, aspirin, and naproxen.
To find new treatments for PKD, we need a better understanding of the underlying pathology. Research thus far has been able to identify 3 genes associated with the disease: PKD1 and PKD2 in autosomal dominant, and PKHD1 in autosomal recessive. As mentioned previously, the mutations of these genes cause cyst formation. However, the relationship between these genes and the disease itself is extremely complicated, because the protein products are involved in many important physiological functions. Fortunately, new drugs such as reversin and pioglitazone, which inhibit cyst formation in mice, are currently being tested in clinical trials on humans. If successful, these drugs could drastically improve the lives of those suffering from PKD. In addition, new imaging techniques will help doctors diagnose PKD faster and more accurately, so it can be treated as early as possible and further delay the onset of its side effects.
Individuals with polycystic kidney disease can expect to live a normal life if early detection, proper treatment, and appropriate lifestyle changes are implemented. However, as PKD inevitably progresses, kidney health slowly deteriorates, commonly resulting in end-stage kidney failure. Nearly half of all patients with PKD experience kidney failure before the age of 60. End-stage kidney failure patients require continuous dialysis or kidney transplant, which is often successful in improving kidney health.
A 55-year-old male patient comes in complaining of sharp pain in his back, sides, hips, and of headaches. The patient also experiences drowsiness, increased frequency of urination at night, and has a history of urinary tract infections. Upon further examination, the patient also has increased abdomen size and displays tenderness in the abdomen region. The patient is diagnosed with polycystic kidney disease. Based on this diagnosis, what type of polycystic kidney disease does the patient have? A. Dominant. B. Recessive. C. Type 1. D. Type 2. The correct answer is dominant polycystic kidney disease.
Question 2. How did this patient most likely acquire polycystic kidney disease? A. Sexually. B. Genetically. C. Environmental pollution. Or D. From the expired milk they drank last week. The correct answer is B. Genetically.
Question number 3. Pick the pair of genes that could be responsible for the patient's form of polycystic kidney disease. A. AC and DC. B. GFP7 and GFP8. C. SEX7 and EGL8. Or D. PKD1 and PKD2. The correct answer is D. PKD1 and PKD2.
Question 4. What major risk factor associated with polycystic kidney disease should a patient be aware of due to his age? A. Fatigue. B. Impotence. C. End-stage kidney failure. Or D. Gallstones. The correct answer is C. End-stage kidney failure.
Question 5. The patient should no longer plan on living a normal life with polycystic kidney disease. A. True. Or B. False. The correct answer is B. False.
Question 6. Polycystic kidney disease cysts can be minimized with a simple doctor's prescription of A. Tylenol, B. Benzoyl peroxide, C. Oxycodone, or D. None, because the mechanism of PKD is still poorly understood. The correct answer is D. None. The mechanism of PKD is still poorly understood.
Here are 5 review questions to go over on your own to test your knowledge of polycystic kidney disease. Good luck! If you are interested in learning more about polycystic kidney disease, check out the following sites. Additionally, there are many support groups around the country for individuals who have PKD, including many in Minneapolis that offer both events and classes. To find out if there's a PKD support group near you, go to www.healthyclass.com.